Now, on to the fight for health care for tens of thousands in the capital region. Democratic Senator Chuck Schumer says the Republicans' Medicaid cuts will hurt local hospitals, so he has a plan of his own. CBS 6's Brianna Cipardi spoke with the senator today. She joins us now with more on his proposed bill. Bree.
Greg, U.S. Senate Minority Leader Chuck Schumer stopped by St. Mary's Hospital in Amsterdam this morning, considered one of the most financially distressed rural hospitals in New York, where nearly 40% of patients rely on Medicaid. Schumer says these cuts could devastate facilities like St. Mary's, so he's not only looking to reverse the cuts, but also extend the Affordable Care Act tax credit set to expire in December. St. Mary's Healthcare Hospital in Amsterdam is a lifeline for thousands of families in Montgomery and Fulton counties. With more than a quarter of its revenue coming from Medicaid, hospital leaders fear the Republican-backed Medicaid cuts could force them to slash services.
We know that there are services and programs today that may have to be evaluated if these cuts do go through.
Rural hospitals are particularly hurt.
They joined Senate Democratic leader Chuck Schumer on Thursday to introduce a bill aimed at not only repealing the cuts, but extending the Affordable Care Act tax credit expiring in December.
Because if these are eliminated, people's premiums are going to go up $400 or $500 a month. They're doing it to give tax breaks to billionaires.
He says it's the largest health care cut in history, funding tax breaks for the wealthy while stripping coverage from 30,000 people in the capital region and 1.5 million statewide.
A number of people have said, I'm not on Medicaid. I said, but your hospital is. Think of it. Your huge streams of Medicaid and Medicare provide the stability, the opportunity to grow and provide innovation and have better services and have workforce.
Already, local hospitals are making changes. Ellis Medicine has moved outpatient surgeries out of its Niskayuna facility into the main hospital in Schenectady. Republicans defend their plan, saying Medicaid spending is unsustainable. Health Secretary Robert Kennedy Jr. was in Texas on Thursday, touting a new federal fund for rural health care.
We have to, and President Trump understands this, preserve these rural hospitals, and they were closing at an epidemic rate. And that's why he put in the big, beautiful bill, the Rural Transformation Program.
Under the Rural Health Transformation Program, Kennedy said rural hospitals will receive an additional $10 billion annually, but industry experts have pointed out the funding won't be enough to replace lost revenue. With full support from Democrats, Schumer says his bill needs just 4 Republican votes to pass. I'm Brianna Cipardi reporting.